want to show you some of the stuff we have here. This is a rainbow chard. This is a very good subject for salads. I'm going to mix some of this leaf lettuce. This is some kale. So I do all the garden work here. No one else does it. I'm the one that takes care of it. I pick all the veggies in it. Actually, I haven't been sober very long now and I'm struggling, but how I got here was I was put on probation. I'm a big-time loser, many felons, many misdemeanors all my life. I'm 58 years old, and it took desperation and forced to be here, and that's why I'm here, but I'm thankful I'm here. When I came, my wife was getting sick. I'd been married. She was a drinker, I was both, and I was so gone in this disease and through my own self and the lifestyle that I lived that I didn't see how sick my wife had become. She was so close to me, and I was emotionally and mentally bankrupt at that point. When she died, I wanted to die too. I could have stayed sober, but the addict and the alcoholic, they always remember what fixed them before. Even though that didn't work, the odds are so great that they'll return without continuous support, continuous therapy. I chose to drink again, and I had a blackout and I went to jail, and I missed my wife's memorial.
I just passed a two-year mark in my own recovery, and I ran into the doctor who facilitated my detoxing, and we got into a conversation, and he said, "You were a train wreck. You were just wrecked." He said, I remember clearly the day I told the nurse to call me to let me know you had died while you were detoxing. And it was like almost like having ice water thrown in your face, like, whoa. Because I think it was in the thick of it. It was just in that insanity and so physically sick, but I don't know if I ever really thought that it would have killed me. I was just clicking through some pictures, and I came upon a picture from 2008. I had to be about 90 pounds. I just was walking dead. I guess, you know, when you're really entrenched and the addiction has you right by the throat, it doesn't allow you to see with like a reality perception. But that's just how deceptively cunning this disease is. It tricks you. Basically, I want what's happened inside of me to be reflected outside of me. Giving back is a huge part of it because, you know, it's a wonderful gift to be given, but you can't keep it unless you give it away. Contributing to improving the quality of another person's life when they're in the fight of their life, because it truly is life or death. It just is the right fit. It's like that puzzle piece, you know, like when you finally find that last piece, it's like when that fits, it's like, I'm home. That's kind of how it feels like here. The recovery coaches approached me probably during the winter and indicated they saw strong leadership potential in me and they wanted me to assume more responsibility. So I'm now a co-volunteer coordinating with Sandy. I just love what we do here and the people that we get to meet. And you know, you see somebody come in and they're just kind of just a little seed and beat down and demoralized and at their lowest point, and over time, you know, they keep coming back, and then you start seeing them blossom. And, you know, my heart just always explodes with that. You know, it seems like as you continue in recovery, you start growing in all kinds of facets. And, you know, mentoring a few women now who are in recovery and really be able to give them a little bit specifically of what I've been given, and pay close attention to the woman who sponsors me and try to pass those along. So now I can hear myself saying the exact things she said to me early on at month 3 that I hated so much. When people come here and they stick, they stick. And they usually end up volunteering here or at least becoming a part of our everyday in and out. So you get to develop a relationship over time.
I've been involved with the rec for about 6 months, and I was brought here from jail. I was looking at like 6 years in prison. They introduced me to their drug court program. I was fed up, I was at wit's end, with my drinking and drugging. I've quit numerous times for short periods of time, but I never could do anything long term, And I've got 2 beautiful boys, and I just kept throwing my life away. But the rec here was just an awesome opportunity for me. I come here and everybody's open arms. You meet so many people, and everybody seems like they truly, really care and concerned about you, and your recovery. And that's the way I felt here. It felt like home as soon as I got here. I don't feel like I have to be ashamed. They don't make you feel like such an outcast, and a goof up, for lack of better terms. They really drive it into you that it's a disease and that you don't have no control over it. And everybody on the outside seems like they think that, well, why can't you just quit? Well, I can't. I've tried and tried and tried, and I can't. I don't know why I can't.
You don't get to be an addict, especially the kind of addicts that we see in the drug treatment court overnight. So the rec center specifically has been a true asset to the drug treatment court. Our people go to the rec center. Some stay there, and they have to follow the rules and regulations of rec. Some just go there daily, but they get assistance with basic living skills. And they get assistance with how to find a job and how to make appointments and how to be responsible, basically, while they're also getting treatment through Centerstone. And so those things are being coordinated where their treatment is being addressed and their basic survival living skills are being addressed.
One of the recovery coaches that used to work here used to say, addiction is measured in broken relationships. And anything broken takes time to put back together. I didn't go to any family events, not Christmas if I could avoid it. And over the last year, slowly but surely, I've started working my way back into the family circle of, my little cousin needs a babysitter, I can come over. Why don't we get together and have craft night where we make some jewelry? Grandma needs her furniture moved again. Okay, I'll be right over. I also got my certified recovery specialist training completed successfully. So I am a registered CRS. I have a few letters after my name now. To get a CRS certification, you have to come right out and say, I have these problems, I've been working hard to recover from them, and I'm doing all right with it.
I work as a recovery certified peer specialist and support peer specialist. And my job is to help people who, like myself, has gone into certain areas of their life, such as addictions or mental health issues. And this is where I come in and I help support their treatment plan, their program. I help them find things that will make their lives better.
I'm a kidney dialysis patient. My kidneys failed about 3 years ago due to an overdose. I had bad kidneys from high blood pressure for years. I OD'd on methadone and Xanax, and it put my kidneys completely out of admission. I was in trouble with the police. I had charges for methamphetamines. I tried a lot of other places, and they couldn't take me or do anything with me because of my other medical issues. Centerstone took me right in and started working with me on a one-on-one basis at the rec center, which was a godsend to me. It helped me straighten my life out, get myself back in order, get my dialysis going, and get an apartment, my car, my driver's license, all the things that I didn't have before I have now. I've got a wonderful coach. All the people down there are great. I've got a good system behind me. I've been addicted for 35 years. I take it one day at a time. It's really hard sometimes. Other times it's joyful, being clean and sober. I've got my meetings there and I've got my classes that I participate in. And I find that since I've got serious with this, that Centerstone is also serious with me. They put some real time into me and I appreciate them very much. I'm glad they was there when nobody else was.
When I first came into Centerstone, the one thing they wanted to know was how was I doing physically? And then they began to treat you emotionally as well. Sort of like getting the soil ready before they can plant the flowers. Then they could start the hardcore therapy. Centerstone was able to support me as far as getting help and keeping me relatively safe while I was in the system. And this was about 12 years ago. This allowed me to safely go through a program called drug court and still get treatment at Centerstone for intensive outpatient treatment.
My name is Julie Haltom, and I'm a recovery coach at the Recovery Engagement Center here in Bloomington. Specifically, working with the EROSC grant that we have, which is Electronic Recovery Oriented Systems of Care, for people who can't necessarily make it into a Recovery Engagement Center or Centerstone, so we can reach out to them and meet them where they are, in their house or a library near them, and work through coaching and the website to reach them and further their recovery.
There are a lot of people that are just afraid to take those first steps to recovery. So we really wanted to focus on how do we make treatment more accessible. And we thought the best way to do it is through technology. So how do we take this concept that we've made physically and make it virtually?
I get on there daily to read about what people have to say in the recovery world, and I post a lot of my own positive comments. I mainly use it at night when I'm home and I'm bored, and I need that kind of support to keep my mind positive rather than being bored and thinking bad thoughts. They have resources for recovery, for mental health, for child care, for food banks. They have a gallery of pictures of people using the rec services. You can find out about the services or get the help you need after hours. It's a scary thing to have to walk in somewhere and tell somebody, I have a problem, I need help. And this is a good way to start if you don't want to do that face-to-face thing or not ready for it.
Another great feature of VREC is that if someone logs in and they are in need of a service right then and there, they need some information available, there is a live person available to chat with them. They just press the Talk to Me Now button and someone is available. Hey, how can I help you? What's going on? Are you in crisis? What can we do for you?
The job, my volunteering, my schooling, and my independent projects and becoming a parent have worked together to enrich my life in ways that I can't even calculate. The healing of my family and being able to work with them is another huge part of it, but I don't know that I would have had the confidence to do that if it wasn't for the strides forward I've taken in other aspects of my recovery. Helping others is a reward unto itself beyond any kind of financial pay, but the individual, I think, doing it also gets a lot out of helping others.
I moved out of the rec here about a month ago, and I still come here. I'm in lines I'm going to volunteer here because I feel like I got to give something back to the rec. I was a hard case, and everybody just opened up and helped me, and I don't have much family. I don't have very many people in my life. So it was really nice to just come here and just have I walked right into like a family scenario, with brothers again, And so it's been a really, really special thing for me.
One day my coach, he looked at me and he said, you don't have to be here now, you want to be, don't you? And I said, I do. I said, I do. I want to be here at the engagement center where I can help people and have this life that I never knew. It's so good to see those folks come. And they see me and I can be an example for them. I can't keep it. I got to give it away. So that's what I do in the garden. I give this stuff away to our community, and it's wonderful. And we have so much to give back, you know. That's what's great about it. I know that we're helping someone, and that's my part in it.